But what I want to know right now is what medications has she been taking? Vyvanse, Wellbutrin, Lamictal, citalopram, Lamictal in the evening again, Seroquel, and Trazodone in the evenings. And I about fell out of my chair. Hey, everybody, it's Dr. Jack.
And Mary.
And welcome back to the Forbidden Doctor podcast. This is podcast episode 156, What to Do When You're Really, Really, Really Sick.
Yeah, and we're sorry we've been gone for about 3 weeks.
It's a whole month.
Yeah, we've been doing a lot of family traveling, Thanksgiving, all kinds of things, but we're back.
We're back.
So, recently we've had some really, really, really sick patients asking us for our advice. And we just love giving them forbidden answers.
The same ones, the same kind of forbidden stuff we talk on these podcasts.
Yeah, we just wanted to share it with you. It's kind of sad that not everybody gets to hear these answers. A lot of our VIP members do, but everybody else out there in podcast land.
I mean, you kind of wonder how mankind ever got this far.
Yeah.
Without all the medical discoveries of the last 100 years.
Yeah.
Well, mankind has known for a long time what to do when you're really, really, really sick. And we're going to talk about that.
So, but before we get to that, for our regular listeners, the next 4 minutes is our financial stuff. And you can just fast forward through it if you choose. But for our new listeners, please listen at least one time so you understand how we do things around here.
We want to take a few minutes to talk about why we do not have sponsors.
Yeah, we've been approached many times to sell different products on our show.
But we've always been compelled to resist these financially tempting offers because the work we're doing here is just too important to be beholden to some brand names who could object or even try to gain editorial control over some of the forbidden things that we say.
Yeah, so we would never allow this kind of advertising on our show.
And others have mentioned that while the knowledge we share cannot be found anywhere else, it is often tied to products such as the whole food supplements from the oldest nutritional company in America, Standard Process, which we often reference during our shows.
And this also would include our own ageless thyroid and long life energy enzymes.
Yeah, and so you might ask, could not our own products be creating conflicts of interest? I mean, have we mistakenly created an infomercial instead of free knowledge podcasts?
No. We do this on purpose.
Yes, we do. Years of experience in our clinics. And almost 500,000 downloads of our podcasts have taught us a few things. And the most important is that the type of nutrient-dense foods most of us need to get our bodies actually healing from years of malnutrition are not easily integrated in most of our lives.
Yeah, the quest for excellence in nutrition has never been an easy endeavor.
Yeah, no one wants to eat raw liver, but absolutely no one is going to sign up to eat raw liver daily for 6 months if that's what it's going to take.
Well, some people will. A patient of ours found she was told she had only a few months to live, and refusing that notion, she went home and threw some liver in a blender with a few spices and drank that every day for months.
Yes.
She lived very well for another 20 years.
Yeah, I met her more than 20 years ago when we were both doing a radio show at the same station.
But many people will not do that.
Well, no.
Yeah.
No, so let us be clear. We reference one-of-a-kind whole food supplements from the nutrition company Standard Process because this is a way to realistically nourish ourselves with the whole food and organ meats we would never eat on a daily basis.
And the reason we do our podcast this way is because it has saved our lives and countless others that we've worked with over the years.
So we sell supplements, and we try to give free knowledge away about how nutrition touches every aspect of our lives, and so necessarily these two overlap.
But we want to be very clear here. Some of you may feel real hardship with even a modest monthly donation and cannot afford even a single month's supply of supplements.
So please then, do not buy our supplements.
Or even try to financially support our show in any way if you cannot afford to. This free information will still be yours forever.
Yeah, of course.
And we want you to take it and use it with our blessing.
But if you like what we do at Forbidden Doctor, there are several ways you can still support us.
Yeah, you can leave a positive comments or reviews on our website underneath the podcasts, or on iTunes or YouTube, or like us on Facebook and follow us on Twitter or on Instagram. That type of support for us is free. It costs you nothing, and we would greatly appreciate it, and it would greatly help our mission.
Yeah. So if you're ready to take your first steps for your own health, take our free symptom survey and let our nutrition specialists develop a personalized protocol for you. And then try some of these one-of-a-kind whole food supplements for yourself.
Yeah, there's a link for this free survey on the very top red bar on every page of our website, forbiddendoctor.com.
Now, if you already support our show, thank you.
Yes.
And please know that you are the very reason we fight this good fight. Your support makes this all possible. Mm-hmm. So now, on with the things they don't want you to know.
Yes. Okay,
this is exciting.
Yeah, our entire office is studying to become functional herbal therapists. And our textbook, it's an incredible, it's the seminal writings of Kerry Bone from Australia, who is the president of MediHerb and has been touted as the smartest man in the world. He's just brilliant. And Simon Mills. And the textbook is called Principles and Practice of Phytotherapy. And you know, since we're talking about really, really sick patients here, I would like to just read the foreword from a Dr. Michael Dixon. He's a general practitioner, MD. He is the chairman of the College of Medicine in London, England, where they are a lot more progressive.
Oh, they are. And you know why? We've talked about this on the show many times. The United States is the only country on the planet that does not have universal health care. So the people that make the decisions about healthcare in America are the pharmaceutical companies, the hospitals, the doctors, and the medical implement or medical equipment companies that all get together and they create this stuff. All these other countries, the government has to pay for it. So the government promotes what works.
Because they don't want to pay.
Because they don't want to have to pay.
The people rise up and say, hey, we don't want to pay so much.
That's why you find alternative healthcare in Europe so strongly practiced as opposed to America.
Yeah, well, you wouldn't find these couple paragraphs anywhere in America. So this is what Dr. Michael Dixon says. Family doctors working in the UK National Health Services know very well that their tools are not suitable for all their work. So many of their patients present conditions for which there are few effective prescription options. Most everyday viral infections are left for nature to take its course, with at best a little symptom relief. We check persistent headaches for pathologies, and if absent, send patients away to find their own analgesics, their own pain relief, basically. We are reluctant to prescribe much for children at all or add to the medication list of the elderly. Even when chronic long-term conditions are being medically well managed, many still come in with persistent tiredness, low mood, stress, distress, and sleep problems. They have disabling joint and muscle pain or a diversity of digestive problems that we tend to lump together as irritable bowel syndrome. So if we add the many menstrual and menopausal difficulties that women can face, we can quickly account for the bulk of family doctors' caseloads and conclude that most of them are not appropriate for prescriptions. What we can so often wish for is a range of remedies that are gently helpful and will speed recovery without setting up new problems down the road and can help patients feel part of their own treatment.
Yes.
So this is just, he goes on, I'm not reading his whole foreword, but he says many times I pull out my prescription pad and I recommend herbal medicine that we have available in the UK with many, many studies. Let me read that right here.
Good.
In our new College of Medicine, we bring together professionals from all areas of healthcare to work with patients towards a new vision of healthcare in which All useful approaches may be integrated around the patient's experience. It has been notable how quickly herbal medicine has taken off as the area that has attracted particular interest in college events. He also says, prominently displayed above the desk in my consultation rooms are the 2 books from Carrie Bone and Mills, and the one that I'm holding in my hand, Principles and Practices of Phytotherapy and the Essential Guide to Herbal Safety. They have a unique rigor and scope in this field, processing thousands of published papers for clinical relevance. They make an ideal resource for someone tackling the diversity of conditions presenting to general practice wanting sound, evidence-based guidance and help in advising patients in their herbal self-care. I am not surprised that they are the seminal texts around the world in herbal education. So that's the book.
This is the director of the Medical College
He's the chairman.
of London.
He's the chairman of the College of Medicine.
And he says this is the textbook.
Yeah. So that's what we're studying in our clinic, and it's so heavy. I had a hard time even picking it up. But it's just sad. It's just very sad when they can't offer any kind of healing help except for drugs, especially to children.
Well, and he mentioned several cases where it's not appropriate to prescribe medication.
Right. And so what do? They say just go home and let nature take its course.
Right, but here we give a medication.
Yeah, well, that's what he was saying.
As we're going to give you some good examples.
Yeah, for people that are really, really sick.
Really,
medicine
really
does a great job with crisis care. You just got off the phone with a patient's wife that's in a crisis, and they do. And you said follow the doctor. I mean, they do wonderful jobs with crisis care, but for chronic problems, this is where they fall really short. So we're going to give you some little bit of information here. So,
well, I just want to add with what Dr. Michael Dixon said. We need to be aware enough to understand that it's Mother Nature that rules this planet, not the medical pharmaceutical complex, though they do try. So let's get started with some stories of some very, very, very sick people.
Okay, we got this email a little while ago. It says, hello, Dr. Jack and Mary. This is Alan. By the way, it's not his real name. But let me start by thanking you. Your podcasts have truly changed my life. It would be such a dream to meet you and thank you both in person one day. I'd love to, Alan.
Alan, listen, there's an old saying out there. Never meet your heroes. You'll be disappointed.
Anyway, he says, I listen to at least one episode every day since finding you 3 months ago. I've taken the symptom survey and have had a phone call, but I have so many problems. I felt like I needed more help. That's the email.
Right. He says, I'm 22 years old and have cystic fibrosis. It was not diagnosed until I was 20, though, because I have a very rare mutation that was only discovered 3 years ago. My mutation primarily affects my pancreas, and my lungs are only a slight concern. And it's usually the lungs that are the center point of cystic fibrosis.
So that's why he makes that distinction.
Right. You get all this fibrocystic material growing inside the lungs that seriously restricts breathing. And there's a lot of other problems throughout the body. But in his case, it's the pancreas.
Yeah, they have a new movie coming out. We saw the previews for that, for 2 patients, cystic fibrosis, and they can't go out in the world, but they fall in love.
Oh,
and,
yeah.
Yeah, it's lung problems.
And severe immune compromise.
And, we both turned to each other and says, we can't watch this movie because they're doing just the opposite of what needs to be done, in our opinion. So, anyway.
Well, he says, my body went without proper support for 20 years, and I was unable to digest anything, and I mean anything.
How do you live?
My pancreas is in a very, very bad condition, and I have severe exocrine pancreatic insufficiency, which means the pancreas is not it's not doing its job, is what it means. Also chronic pancreatitis, liver disease, kidney disease, osteoporosis, severe hypothyroidism, Crohn's disease, lifelong severe constipation. I've had 2 intestinal bowel obstructions and developed toxemia after the first one. SIBO, small intestine bacterial overgrowth. Mm-hmm. Massive candida overgrowth, have tested positive for high levels of glyphosate, horrendous gas, bloating, pain, reflux. The list goes on.
And I'll take over. I was recently listening to podcast 78 and heard about exocrine pancreatic insufficiency that he just mentioned. I have eaten an incredibly strict and healthy diet my entire life. See, and I wonder what that is,
Yeah, you know.
They're usually thinking it's a lot of vegetables.
Right. They think a lot of vegetables, a lot of fruit, very little meat. That's the average understanding of a healthy diet.
At first, it was just my exocrine side of the pancreas that was bad, but I now have developed insulin resistance. You've got an exocrine and an endocrine side of your pancreas.
Yeah,
your pancreas is both an organ and an gland.
Yeah, the endocrine side is the insulin. The exocrine is all the things that take place inside the pancreas itself to be excreted.
So he goes on, I'm doing my very best to follow a high-fat, ketogenic GAPS-style diet. But with the EPI, the insufficient pancreatic enzymes, I am really struggling with fats big time, even with the excessive enzyme supplementation. I take prescription high-dose pancreatic enzymes for cystic fibrosis patients. Now, see, I wonder if they're the type that Dr. Kelly used where they were activated and they don't work as well.
I don't know. Good question.
And they've got to have fat in them also.
Yep.
But which are, Lee enzymes do. But anyway, I'm taking high doses of pancreatic enzymes for CF patients as well as 4 other enzymes because my pancreas is so bad. I nearly died over the summer from my past pancreatitis flare. However, I'm completely intolerant to carbs. Just tested insulin resistance and really concerned about developing diabetes. So I'm really trying to do low carb, but having so much difficulty, and I'm so sick from all the fat.
Okay, I think we've described a very sick person. They go on. My main question, though, is about my liver and my pancreas. Like I said, all my tests have shown that I have massive levels of toxicity and glyphosate in me, as well as literally being eaten alive with candida.
See, and that's what makes me think that he's eaten a ton of vegetables because he's
fruit.
Massive levels of glyphosate in me.
But every time I try to detox, even just taking probiotics or nutritional yeast, due to my liver problems, and my liver enzymes run about 150 to 175, and normal's about 5 to 40. I can't flush out the toxins, and I get extremely deathly sick. I got myself out of acute liver failure 2 years ago by using extreme high-dose yellow dock herb.
See, if he had just eaten liver, like eat it or take it.
But because of my Crohn's now, I'm worried that would reverse the progress I've made with healing my gut because of the high tannin and alkaloid content of the yellow dock. For now, and it's really bad, my whole body is swollen with toxins circulating throughout it, I am going to just do yellow dock again and pray it works and doesn't make my gut worse again. I'm desperate and truly at my wit's end. Thank you for your time. Any help you can give me. I really enjoy your podcast.
And see, this is where we are when we don't have medical healers. We have to just guess. We have to, luckily we have the internet now and we can do internet searches and hopefully, but, it'd been, and then, our podcast, I suppose he's listened to Eat It or Take It on the liver. I don't know, but he's, throwing in herbs, trying to basically play doctor. And you have to be very, very careful with this type of massive, very, very, very sick, really sick.
Yeah, very sick. And the amount of drugs that they must be taking. And so he didn't tell us really what drugs he's on or taking. Yeah. So there's obviously side effects associated with that.
Well, what we recommended to him was, because it was so overwhelming, we wanted to put him on a promorphogen for his pancreas, pancreatrophin, PMG, on an empty stomach. You take 3 of those on an empty stomach and 3 at night, maybe a liver protomorphogen, the hepatrophin, PMG, take that. But what we decided to do, because it was just pretty overwhelming, and he mentioned in another email, actually, he had sent us before that he didn't have a lot of money, and we wanted to help him the best and most foundational way, because you can't chase all of these symptoms. You just can't.
No.
So we put him on. We said, you need to listen to these podcasts. Well, he had listened to a bunch of them. And we said, just cut everything out and just go with bone broth. Just bone broth and very slowly start adding things back in.
Yeah.
And we recommended, of course, our Lee enzymes, our long life energy enzymes. And speaking of that,
we got a problem.
We got a problem. Our inventory is gone, and we were supposed to have that refreshed the end of October, And then they told us the end of November.
Now, and we just got off with the owner and president of the packing company.
Our compounder.
And he said they should have it within 2 weeks. They have to sequester it for 2 weeks to check it for purity. Mm-hmm. So maybe at the end of the month, beginning of January.
But we are out. In fact, we don't even have any in our... Well, we have a little bit left in our house. You'd think that we'd have, a couple cases. But we don't. We sell it as fast as we can get in. It's extremely... you had a great testimonial the other day.
Yes. A lady I took care of, I think it was just yesterday morning, in fact. And she was talking about how... She says, I just bought 4 bottles last week. And I said, well, there's only a few left out there.
There's like 4 left,
Yeah,
I
and
think.
she says, well, I'm going to get that many more.
Well, they're gone.
Because she said, it has changed my energy levels completely. I used to, sometime after lunch, slow down to the point where I not only couldn't get anything done physically, I couldn't get anything clear to me mentally. Mm. And she says, ever since I started using these enzymes, I do no longer have that problem.
Yeah, so we're really sorry. We did see this coming, and we thought
we had 4 or 5 cases left. We said it's time to get some more.
Yeah, we contacted them. They said the end of October, no problem. Then the end of November, and I kind of threw a fit because we got our Asia thyroid shipment in before.
Yep.
But apparently the pancreas, the porcine pancreas that we get from New Zealand, where the cleanest cow or the cleanest pigs, the cleanest air, the cleanest everything down there in New Zealand is, they're having a hard time procuring them. And they did get them from 2 different suppliers, but one of them has stopped selling them. And they said there's not enough demand for them. So all you guys need to go out there and tell people about these long life energy enzymes so we can start selling millions of bottles of these and change the world. Change the world.
All right, let's go on to the next one.
And so they did tell us, they said, you can do bovine. They had some bovine, some cow
important
pancreas.
Point. I'm glad you mentioned that.
Yeah, and they said we could make you some up in the meantime, but it would be bovine, not porcine, not pork. And we said no, because a pig has almost the same DNA as ours, and they're omnivores like humans. So they have the carnivore, they eat meat and they eat vegetables. So they're omnivores and herbivores, but a cow is only an herbivore. And so their pancreas does not produce the enzymes that we need in our products. So we were saying, no, we are only going to have the best in our product. I think it's one of the best products in the world. I really do.
All right.
Okay, another one. This is about Janet, not her real name.
Yes.
We got a call from her husband one night.
And she came down with some incredibly, not odd, just incredibly complex, difficult, very, very serious central nervous system disorder type of symptoms that happened almost overnight. Serious nerve interference problems, weakness, paralysis.
Paralysis on the whole one side of her body.
Yeah, and I mean, it sounded like a stroke
at
did. First. But she's too young to be having a stroke. And so I got to thinking, I think I know what this is, but I don't want to say it out loud to her husband. We'll just,
well, you did. You said...
I eventually got around to it. Has she had a flu shot?
Yeah, because eventually she was diagnosed with Guillain-Barré syndrome, and that is almost exclusively from a flu shot.
Yeah, there's other causes of it, but the first thing you ask when someone's diagnosed with Guillain-Barré, did you get a flu shot?
Yeah, first thing. So, Jack, what did the ICU nurse tell you about the side effect when you were in school for your undergraduate work?
Well, I was working in a hospital. Mm-hmm. And because I was in the pre-med program, and I spent if I wasn't in class, then I was in the hospital working in various departments, and I was in the ICU at the time. And this fellow was brought in, and he not only was paralyzed, he couldn't breathe.
Ooh, that's where it's deadly.
Yeah, because I think it was affecting the phrenic nerve. It comes out of, I think it's C3, 4, and 5 of the neck, forms the phrenic nerve that controls the diaphragm, and it was paralyzed. They had to breathe for him.
I just took a deep breath.
And he had a little bit of movement of the hands, but there was so much numbness going on, and he could not move from the waist down. And that was the first time I'd ever seen anything like that, and I asked, what is this? And she says, well, he has Guillain-Barré. And I'd never heard that word before, so I went and did some research on the word.
It's a Navy song, I think.
Anyway, this is an extremely serious thing because it can kill you.
Yeah.
Now, it's also listed as self-relenting. In other words, it takes care of itself after a while once the massive inflammation in the spinal cord lets up.
So what did the nurse tell you?
Well, she said that, I said, well, what causes this? Because I'm waiting for some horrible bug from sub-Saharan Africa, like Ebola or something like this, or something in the wilds of the Amazon. And she says, oh, no, it's a flu shot. He came down with the symptoms right after he got a flu shot.
Wow.
And so, this is...
Well, and
but the
mercury
fellow
neurotoxic.
said, yeah, the fellow said, no, she hasn't had a flu shot. And I said, are you sure?
Yeah.
Are you sure?
Yeah,
you better look closer. You better look closer as to what's going on here because I'm not sure I believe that.
Yeah.
This is...
Well, and then you asked about medications and all the stuff.
And then when I saw all the medications
and then
that she's taking.
He didn't tell us for a long time about these medications.
Oh, my goodness.
And then he finally sent this. And you get to read the list because...
Well, I asked him, I said, I also need to know, because he's asking me, what do I do? What do I do? Well, you're in the hospital. You're going to do what the hospital says. But what I want to know right now is what medications has she been taking? Vyvanse, Wellbutrin, Lamictal, citalopram, Lamictal in the evening again, Seroquel, and Trazodone in the evenings. And I about fell out of my chair.
Yeah, I mean, and who can know what is wrong? Let's go over some of these. This is Vyvanse. It's given for ADHD in adults.
Yes.
And the side effects are blurred vision, dry mouth, excessive grinding of the teeth, nosebleeds, and profuse sweating.
Yeah. Now, Vyvanse is essentially an amphetamine. It has an amphetamine effect, and amphetamines have a lot more side effects than this, but those are some of the most common.
And then the other one, Wellbutrin, is an antidepressant, and it's added to other antidepressants as an extra kick.
Yeah, if you get an antidepressant for whatever depressive problems going on, and it's not quite getting you over the fence, they'll also add Wellbutrin to it because it gives a kick to the SSRIs.
Okay, and let's talk about some of those side effects. You've got agitation, dry mouth, insomnia, headaches, nausea, vomiting, constipation, stomach pain, dizziness, ringing in the ears, vision problems or blurred vision, loss of interest in sex, sore throat, muscle pain, itching or skin rash, increased sweating, increased urination, tremor, changes in appetite, weight loss or gain, joint aches, strange taste in the mouth, diarrhea, and seizures, especially at higher doses. Then,
and that's just Wellbutrin. And then Lamictal, which is an anticonvulsant, for Pete's sake.
What was she on this for?
Lamictal is a very dangerous drug.
Okay, the side effects are this: drowsiness, ejaculatory disorder. I don't think she'll have a problem with that. Nausea, insomnia.
Diaphoresis, which is profuse sweating.
Other side effects: suicidal tendencies, agitation, diarrhea, impotence, sinusitis, anxiety, confusion.
Exacerbation.
There
we go.
Of depression, lack of concentration, tremor, vomiting, anorexia,
and
dry mouth.
Yep.
Then
if that wasn't enough, citalopram.
This isn't
another
the last one.
antidepressant.
How many is she on? Suicide is the side effect, the main one, especially in younger people. She was like 40 or is like 42, right?
Something like that, yeah.
And it has potentially life-threatening serotonin syndrome. That's got to be bad. Can't make serotonin? I don't know. We didn't look that up.
No, it's too much serotonin.
Oh.
Serotonin syndrome is what...
that's right. I did read about that. Yeah,
and it's, the main neurotransmitter of consciousness. Mm-hmm. And too much serotonin can cause a backfire inside of the brain and can actually be deadly.
Yeah. Don't even want to know. The other side effects of, how do you say that again? Citalopram?
Citalopram.
Citalopram.
Mm-hmm.
Insomnia impairs your thinking or reactions, problems with memory or concentration, and be careful if you drive or do anything that requires you to be alert. Can have severe nervous system reactions. You can become very stiff and rigid muscles, high fever, sweating, convulsions, faster uneven heartbeats, tremors, feeling like you might pass out, insomnia. Oh, I already said insomnia on every one of these. Difficulty having an orgasm. It can also pass into breast milk and may harm a nursing baby. You should not breastfeed while you're using this medicine.
And she's not breastfeeding.
Yeah, but even still.
And then there's Seroquel,
can't be good.
Another very powerful antipsychotic.
These side effects are weight gain, that's lovely, breast swelling or discharge, missed menstrual periods. See, and when you stop life,
Yep.
that's a bad drug. Missed menstrual periods, not good. Increased appetite, headaches, trouble sleeping. Older adults with dementia may have a slightly increased risk of death when taking
Slightly
Seroquel.
increased.
Yeah, so this is, you're missing menstrual periods, but you can't have an orgasm anyway because you're taking that. This is just crazy making.
And then the icing on the cake, trazodone,
And
another
gain weight.
antidepressant. These are 4 antidepressants.
4 antidepressants. Man, see, this is somebody that's really, 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 really sick,
And this
made herself sick.
This woman is very well educated. I can't believe that.
I
this is
think
happening.
she has a PhD.
She might. Yeah, she might.
Yeah. So this lovely one, has a black box warning. Trazodone. Oh, and explain what a black box warning is.
Well, it's where the person who is buying the medication has to be verbally warned by the pharmacy or whoever's prescribing this stuff, and there needs to be some feedback information to the person prescribing this stuff, because this is an extremely dangerous drug.
Really dangerous. Suicide is the huge side effect of this.
Especially for people younger than 24. Depression, panic attacks, and suicide.
I love that it causes the very problem. It's an antidepressant. Causes depression, panic attacks, suicide.
Now remember that conversation I had with that pharmacologist at one time. And a pharmacologist is a PhD pharmacist.
Wow.
And I asked him about
You got to have
drug
serious
drug interactions.
personality problems to get
Well, this pharmacologist does not work in a pharmacy. He works on private retainer for several different medical groups.
Research.
Because they ask him, can we mix these drugs together? And so I asked him, I said, is there any way to chart the interactions of this many drugs? He said, we can't chart the interactions of 3 drugs.
3.
We cannot chart
This
the
is
interactions
6.
of 3 drugs.
This is 6.
Yeah. In other words, when you take the chemicals, and remember these are chemicals, they're poisons, and you start mixing them together, nobody studied what happens when you take trazodone and Seroquel and mix these 2 things together, and then on top of that, you're also adding something like citalopram, but then Lamictal, an anticonvulsant, and you start mixing these chemicals together, you end up with a super drug. And there's no studies.
No.
So all of a sudden, these massive symptoms show up of massive central nervous system poisoning in this lady. And it may not have been a flu shot. It may have just simply been the
Can you imagine adding
cross-action
mercury?
of these drugs.
Can you imagine adding mercury to this cocktail?
If there was a flu shot.
If she did take a flu shot, because you kind of still don't believe her, or believe him.
Well, I'm not sure.
But who knows? When you're taking this many drugs, throw in a flu shot.
What will that hurt?
What's that going to hurt? So sometimes the answer with these really, 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 really sick people, the only answer is to slowly get off all these medications. And to do this, you have to support your body foundationally. Okay? You cannot just obviously stop them. Never, ever, ever do that. You go to your doctor.
Especially if you've been on them for years.
Oh, yeah. I mean, Prozac alone, they say to take a year to slowly get off Prozac, because then suicide is a huge side effect. So you have to support your body foundationally, and this requires serious, serious gut reconditioning.
Yes.
Just to start. Then, so that's so you can break down your food so you can rebuild the body and foundationally help you. Then you need some therapeutic supplementation.
Yes.
Serious therapeutic supplementation because you won't get it from your diet. And always, always, always do this with your physician's knowledge of what you're doing, especially if you're on this many drugs.
Yes.
But
Yeah, you do not do this without your physician knowing what you're doing.
no, no, no. Don't ever just stop your medications. But that's really the only answer to this, is that you've got to get off this medication and you've got to fix the reason for needing the medication.
Yes.
And as we talked about in a couple podcasts ago, the Easy Mag, because of all these depressive stuff she's on, the Easy Mag would be a wonderful thing to add because it crosses the brain-blood barrier.
And the studies show that another chemical effect in the body of many of these SSRIs is it allows more magnesium across the blood-brain barrier. In other words, when they would do blood studies and they would do autopsy studies after death had occurred for whatever reason in people who've been taking antidepressive medications, they found a lot of magnesium in the brain tissue.
So this would be
it doesn't normally get there to those kinds of quantities. So they think, well, the drug did it. Well, there's an easier way to do it with no side effects. And magnesium in the brain is absolutely essential for its antidepressive benefit.
Yeah. Yeah, I remember talking about that very thing now.
Yes.
Now you mention it. Yeah, so I'm glad you thought of that. And it's very safe, and you can't just go out and get magnesium at a local store.
No, it's only a special kind of magnesium.
It's got to be a special kind. There's 24 different types of magnesium in this product.
In the body. In the human body.
Yeah, but in this, 22, actually, I think they finally decided. Standard Process says that, and they don't know which one it is that brings it into the cerebral spinal fluid and actually gets into the brain. So we have another product called magnesium lactate, but it does not get into the brain, but it helps the bowels and other things.
Yeah, other
heart
areas,
arrhythmias, yeah. But this Easy Mag, and you've got to go listen to that podcast because we go into it in detail why it helps. So that's what we would recommend for her, is she's got to get off this medication, especially if she didn't have a flu shot and she came down with Guillain-Barré. I mean, that's super deadly.
And this is what you call a big red flag.
Yeah, huge.
This isn't something that once the symptoms have been taken care of and some normalcy returns, that everything's okay.
Yeah.
This is a warning of something much more serious to come.
The husband kept saying, listen, I can't force her. I've tried to get her to come in and do some stuff because she's just like a zombie. I mean, all this insomnia and everything else, all these things. But he says, I can't. So hopefully, they did send a text that said she did.
Once she comes out of the hospital, they want to come in.
She said she
wants
wanted
to sit down and talk.
Yeah, sit down and talk. Wow. We got to really.
All right.
Okay. Then Carol texted on our VIP members. We have this app. It's called OMD app, where people, when you're a VIP member, can text Jack and I and our entire staff anytime, 24 hours a day, which is just phenomenal support. And anyway, she texted and she says, I'm feeling so sad as my dad just had 30 tumors removed. And due to there being a gallstone, they took out his gallbladder.
Oh my, a gallstone?
Then he had chunks of kidney and liver removed with tumors. So sad. It's so unfortunate that nutrition is a lost art of healing. And I wrote back, I said, a gallstone? Just one? And they took his gallbladder? And Carol wrote back, yeah. And in the phone recording message that the doctor sent, he acted like he was a hero for doing it. Well, inside I was dying. Just one more battle he has to deal with. Her dad has to deal with. Can you... So Dr. Josh, your son, jumped on the thread too and says, the people have got to face the fact that there is something wrong here when our only fix is to hack up someone's insides like Braveheart style.
Right.
Oh my goodness. And then he sent this really cute meme I think he made. It's so cute. And it says, while I was in there, I removed a perfectly functioning digestive gland for you. You're welcome.
Yes.
Oh, I would laugh. I would cry, but it's so sad. So then, but this has a little bit good ending. So Carol's dad went in for all this surgery, 30 tumors and all kinds of problems. But she said, I have to share the story with you and Jack. I put my dad on long life energy enzymes, and he was actually taking them. I also put him on cruciferous complete. So during surgery, and when the doctor was just about ready to remove his tumors, there were at least 30, he realized they were not attached. So he was sure it was a different type of tumor than he had originally thought because they were not attached. However, they tested them after, and they were the type that should have been attached.
They're much more serious. They penetrated the basement membrane and were invading organs. That's what he thought. But when he got in there, they were not attached.
Now, see, that's just anecdotal, but that's what we have explained, and Dr. Gonzalez has explained for years, and Dr. Isaac also, that took over for Dr. Gonzalez when he died, that these pancreatic enzymes, the trypsin goes in and cuts off the malignant hormone that's going in and establishing a blood supply with this tumor. The trypsin cuts it off, and then the chymotrypsin goes in and liquefies the tumor.
Yes.
So if he had been on them longer, who knows what could have happened, because we've had many stories about that happening where growths on organs have just disappeared. So this was really cool. It had a somewhat happy ending, except for now he doesn't have a gallbladder. I mean, my goodness.
So well, you don't need your gallbladder.
Yeah, I just did it.
Mother Nature just was a little silly that day. He said, well, let's just put this little bag right here next to the liver.
It's just Braveheart style.
One of these days, they'll wake up one of these days and realize they don't need it, so they'll just cut them out. Well, here's another one that came in. I had my siblings over to dinner last Saturday night. My 61-year-old sister's hair is getting so thin it's scary. So she had her thyroid removed 10 years ago because of precancerous nodules that kept reappearing. She's having almost daily episodes where she cannot speak above a whisper. She's been told this is because of some damage that was done to her vocal cords when her thyroid was removed.
Scream.
She's scheduled with a specialist in Salt Lake next month. Any suggestions on the thinning hair? Now, that's not really, 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 really sick. That's just a side effect of being really, really, really sick.
Really, really, really sick. So I wrote back and I said, how barbaric that they never tried to fix the reason for the nodules on her thyroid 10 years ago and just cut out one of the most important glands in the body. But it is what it is. Yeah. It's a feeble attempt because, as you know, she needs I said, I'm going to give you, what I'm going to recommend is a feeble attempt because you know she needs a lot more support than this simple recommendation. But because she was just asking about the thinning hair, I said I would recommend for now she does a symptom survey and send it in to us, and then take 3 ageless thyroid a day and 9 Line MB6 a day, the flaxseed oil. Then once she does that, I'm sure our nutritionist will suggest she get on GAPS to heal this foundationally. And if she's willing to do that, then I can refer her to a lot of podcasts that will help her through this.
Yes.
Or this lady is a VIP member, so she's asking questions about her sister, but, she can ask any questions once you're VIP.
So here's another one. Hi, Mary. Do you do biomeridians these days? Oh, I don't know. I have a young friend, son of my husband's best friend, who is an off-the-chart athlete. He scales mountains by day and twitches, sweats, anxiety, cramps, and has double vision. Imagine an athlete having these kinds of problems.
So he has.
He's just come off an extreme, all-organic, all-vegetable and fruit diet. He's seen all these things he's doing, and all he's eating is vegetables and fruit. He's seen tons of doctors, has had lots of tests. He's been told his micronutrients are deficient. In some areas, so he's backed off on that diet and is eating some meat. I think, anyway. Long explanation, but could you see him? Now, here's a person who you wouldn't think is sick, but he's very, very, very sick.
Everybody always thinks if you're skinny or
if
you're
thin,
exercise
if you're thin, you're healthy.
You're thin, you're healthy.
Yeah.
Yep. So I wrote back, sure. But in the meantime, please have him fill out the symptom survey. However, he's got to get back. He's got to continue his animal foods right now. An athlete like that cannot build muscle or rebuild anything with fruits and vegetables.
Amen.
You don't build new biceps with broccoli, and you don't make new eye cells with strawberries.
No, you don't. No, you don't. And you don't build strong bones with oatmeal.
Yeah, and we never heard from him. So very sad, but that's what I would have
remember,
recommended.
But he also needs, if he's an athlete, he needs a correction because structure, function always follows the structure. If the structure's off, the function's going to be off, including his conditions.
Yeah, like the nervous system, for instance, that little thing.
So here's another question for you. This came in on the VIP to Mary. Hi, Mary. Just wanted to check with you.
See, that's what you can do, and you're a VIP member.
Yeah, you can text us, and we will give you some rather lengthy answers. I had an episode about the question is asked, well, why don't you do that for everybody? Well, everybody is many thousands of people, and we have an audience all around the world now, not just here in good old Utah.
They're texting us from everywhere.
And so, we have a VIP relationship for a certain amount of money every month. You have access to us all the time. So let me get to this. I had an episode about 6 months ago when I was having...
6 weeks ago.
6 weeks ago when I was having a bit of diarrhea.
Quite a bit
of diarrhea, which led me to the worst day of having a time when I had a violent diarrhea attack accompanied by nearly passing out. Now, I try to imagine what that would be like. A violent diarrhea attack with nearly passing out? Wow.
That's a bad one.
This scared me enough that I went to see a gastroenterologist, and by the time, a PA, a physician's assistant. And by the time I got into him, things had calmed down a bit, but still lots of diarrhea. He prescribed a probiotic and Pepto-Bismol twice a day and Metamucil once a day. And that's it. I quit the Pepto pretty quickly as everything was coming out purple-black. I don't know.
Can't be good, right?
No, can't be good. I made myself some bone broth and took that every day. I'm feeling pretty much back to normal, but still taking the Metamucil. Is there any harm in that? There's a long story to just ask a question about Metamucil, but there it is. No, it's a very important story to set the stage for this.
There he is.
Because that's all they had to offer? Pepto-Bismol and Metamucil?
You know, it's like the chairman of the medical over in England. You know, that's all they have. I mean, they don't want to add more drugs in. And I mean, at least decent doctors don't. But Pepto-Bismol, I mean, she was nearly passing out. So anyway, I wrote back and I explained Metamucil is a bulk-forming fiber laxative. Yeah. This medicine works by absorbing liquid and swelling in the intestine to create a softer, bulky stool that's easier to pass. But it's only supposed to be used occasionally.
Yes, not long term.
But it doesn't fix anything foundationally. See, this is why we have no healers anymore. You know, this is why the Forbidden Doctor is so important to get out here. So he recommended stuff that might get rid of the symptom, might bulk her up, and so the diarrhea stops, but never even approaching why that could have happened. Okay? So here's what I said.
What was the body doing? What was going on in the body that was trying to wash itself out so vigorously,
violently,
with violent? I mean, I'm sorry, and it's not funny, but the image that comes in my mind with violent diarrhea is kind of like a machine gun. But but what was the body? What was going on in the body that it needed to do that?
Well, something very important.
Yes, it had to get rid of something so bad, so badly. Quickly. That it was a violent expulsion.
You know, we call, as Dr. McBride says, we call to us viruses to clean out something much more terrible.
Yes.
Always, always, always trust the body.
Yes.
Always, unless you've had some surgery or something and they have to mitigate some of that damage. But
so what did you tell them to do?
What needs to happen is to address why you got the never-ending diarrhea in the first place. I would suggest using lactic acid yeast wafers to help with the underlying problem. Mm-hmm. They will acidify the colon, enabling the good bacteria to become active in the colon and wake them up.
Yes.
See, this is foundational. Then it will convert carbs into lactic acid to lower the pH to 5.5, where healthy bacteria can thrive.
Exactly.
I would take 6 lactic acid yeasts a day for about 5 weeks, then switch to ProSymbiotic, our probiotic, which has prebiotic inulin in it. Now, you know, I did ask, but I cut it out here. I asked, why didn't you call? Why didn't you? You're a VIP member. Why didn't you call us before running in and get Pepto-Bismol? So anyway, I continued on. It sounds like you have a disruption in your gut flora and your body was trying to get it out. Or maybe nobody really knows for sure. But as the doctor exhibited, Pepto-Bismol, really? He didn't know how to financially help this. I would help out your body with lactic acid yeast wafers, raw egg shakes, the Mary's milkshake, and maybe a couple coffee enemas once a week or so. I know you hate it when I say enemas, but you might look into it. The lactic acid wafers will help foundationally. The probiotics, which the doctor recommended, don't really have a lasting effect.
Yes.
They work only when you're using them. They are not curative. Just like thyroid hormone medication,
Yeah.
it only works while you're taking it.
Exactly.
You go off it, psh, you're no better. In fact, you're usually worse. But probiotics will only last a couple days or a week at the most after you stop taking them. They don't recolonize the gut. That's important. So, lactic acid yeast wafers will. Again, they will help change the pH to a healthy level where the good bacteria can thrive.
Absolutely.
Okay. So,
Let's just recap this, because if we could go on an entire week
we have so many stories.
with the stories we get.
Yeah, and I know, a lot of times you need help with this, and we get really scared when people run out there and try to play doctor, and they get on all this synthetic vitamin C. Vitamin C cures everything. I read that all over the internet all the time. And vitamin D3. Oh,
Rat poison.
Small mammal poison, vitamin D3. And it's so scary when people go, oh, vitamin D is the cure-all for everything. Vitamin C is the cure-all or colloidal silver. It's the cure-all for everything. And then you turn blue, silver. So we don't want you to do that. We want you to get some help. And anyway, so first of all, here's the recap. First of all, we don't treat anything.
Of all these cases you've just heard and all these symptoms and seriousness of some and less of others, we do not treat these people. We do not treat their disease. We do not treat their condition. We do not treat their symptoms.
Notice I didn't even treat the diarrhea.
Nope.
I'm just like, let's
No, we
find
don't.
out why this happened.
We want to know why it happened, and then we make some suggestions based on that.
So we just recommend supportive foods, diet, supplements, and herbs that have a rebuilding effect. And understand, if your gut is healthy, this cannot not work.
Yeah. Every time it will work.
It always works.
It always works.
It always works.
Some people need to do it longer than others, but I don't think I can even come up with a case where there's one that comes to mind that was, after months. But most people within a matter of a few weeks.
Well, I asked you, was their
turnaround.
gut healthy? Could they break down the supplements they were
that's
even
a
taking?
good
So
question.
always start with the gut. Just start on bone broth. If nothing else, do a 3-day cleanse with bone broth. Just eat bone broth for 3 days with lots of water, and give your digestive system a rest. Then
you want to do a symptom survey for sure, because we need to find out which of your body systems are needing the critical support, and then you'll be able to begin on a forward healing path. Remember, your body, as Mary is always saying, is set to repair and restore. It's not designed to degenerate. It's set to repair and restore
it is
itself.
set. You have to pause after that. Your body is set to repair and restore, not to degenerate. Isn't that beautiful?
Well, it's a self-healing machine.
Yeah, it's like a vampire.
Imagine if your car was a self-healing car.
Wouldn't that be so cool?
Yeah, you just give it the right gas, give it the right oil, and every time a ball joint went out, it would fix itself. If the catalytic converter began to be impacted, it would clean itself out.
Beautiful.
If the rocker arms...
it doesn't do that, but our bodies do.
But our bodies do. Mm-hmm. So then we want you to listen to these podcasts.
Yeah. The podcast we would recommend, if you want to write these down, there's 6 of them, but they're very critical. Number 1 is number 4. Listen to podcast number 4, Intro to the Gut. Then listen to podcast 42 and 43, which is Scientific Healing. This is GAPS, being healthy from the inside out. And then the other one is What is GAPS and How Does It Work? That's a good one. And then podcast 102 is 3 easy steps to stop heartburn, gas, and bloating, because, of course, that is the beginning of all diseases.
Yes.
All diseases begin in the gut. So if you have heartburn, gas, and bloating, it's just a matter of time before something crashes.
Serious is going to happen.
Serious, and you get really, 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 really sick. So, and then listen to podcast number 135. It's called Gap Soup, Saving Your Life in 2018. We did that almost a year ago.
Mm-hmm.
And then the one we just did a little while ago is number 150. It's called Gaps, Quick and Easy. So if you think you're overwhelmed with how to do gaps, listen to that one.
And so once you listen to these once or twice or 3 times if you need to, and you write down some notes and pay attention to what's being said here, I guarantee you will know 100 times more than your gastroenterologist has ever imagined
Pepto-Bismol.
about getting the gut healthy.
Pepto-Bismol.
Now, even if you've... Yes, Pepto-Bismol.
I'm sorry.
Throw in a little Pepto-Bismol.
Get some Pepto-Bismol in there.
Yeah, if you like that MIDI flavor, throw in a little Pepto-Bismol. When you got that GAPS broth, throw in a little Pepto-Bismol. Oh, now, even if you've done it before, don't forget to do or recommend our free symptom survey to others, as well as you, that we offer at ForbiddenDoctor.com. At the bottom of the survey, you'll have a space to write in what you think you're suffering from or what you feel like your major problem is. And then we'll send you a protocol, and we will personalize it just for you based on the questions that you answered in the symptom survey. And if you like, you'll also get a free 30-minute phone consultation from one of our nutritionists. And if you want mine or Mary's help, you just join our VIP membership, and you can personally text us 24/7, let alone many other benefits that come with that are described in podcast 131.
And many of you will be finding us for the first time as you're listening to this. So keep in mind the protocols on our website and what we're talking about are only available to logged in users. But you can create an account instantly by taking our free, no obligation symptom survey. And you'll also have the opportunity to have a free 30-minute phone consult when you do that. And understand, this survey saves you money in the long run because you're not taking supplements you don't need, that vitamin C out there. And all of this is at no charge to you.
At least 1 out of every 5 or 6 new patients that I consult with will have a little plastic bag full of all the supplements they're taking. And I ask them, well, who told you to take this stuff? This stuff isn't going to do you any good.
Guess. They hear an ad.
They hear a radio. They go to a health food store, and some salesperson in the health food store says, well, people are buying this over here. And I'm looking at it and I said, I'm so sorry. Take this stuff. Do you have a garden? Yeah. Well, put this in your compost pile or put this in your garden next year because your body can't absorb this stuff.
How you get that
but
gut
the
healthy.
Plants will absorb these things and convert them into a form that those sweet tomatoes at the end of the summer will be able to give you.
Or an animal can eat, and you can eat the animal.
And if you decide to purchase the supplements that are recommended to you, you can get them at a 10% discount if you sign up for the Text Blast.
These Text Blasts give you fantastic coupons every week. So here's how you do it. You just text the word healthy to 41411. So write that down. You put the numbers in like a telephone number, 41411, and then put healthy in the line.
In the message,
and we will text you back a coupon which you can use on our website, ForbiddenDoctor.com, when you check out.
And if you'd like 20% all the time, you can join the VIP membership.
Off of the supplements.
Yes, 20% off all the time.
And you can join our VIP membership. Just go to ForbiddenDoctor.com/VIP to listen to a short video on the benefits, and let's start your healing process today.
Or you can call the office. You know, some people just don't want to fool with the computer, so call the office at 801-523-1890, and they can help you answer any of the questions about the supplementation, as well as our Forbidden Doctor's mission.
So we are revealing health secrets they don't want you to know. And remember, your patronage of our offers keeps this podcast on the air.
So thanks, everybody. And please go to iTunes and rate the podcast. I mean, if you liked anything you've heard so far, you will help us by going back to iTunes and giving it a good rating. And we would so appreciate that because with your simple rating, we can spread this forbidden information far and wide. So if you've enjoyed this at all, or enjoyed any of the things we've done, please go to iTunes and leave some feedback or just rate us.
Yeah.
It would be much appreciated.
Give us some stars. And don't forget to tell your family and friends to take our free symptom survey at ForbiddenDoctor.com to find out where they are because it's free.
Okay, now it's my turn.
Okay.
The statements made in this podcast about specific products have not been evaluated by the United States Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent disease. All information provided or any information contained on or in any product, label, or packaging of this podcast is for informational purposes only. It is not intended as a substitute for advice from your physician or other healthcare professional.
Oh, you barely got it. It's not intended as a substitute for advice from your physician or other healthcare professional. This is informational only.
I'm joking about this, but this is legal and this is just for informational purposes only.
Don't play
and
doctor.
If you are under the treatment of a physician and you think we're saying something contrary, talk to your physician about it.
Yeah, don't play doctor. Thank you for listening to this forbidden information and our forbidden podcast. Join us next time for another in-depth discussion of forbidden knowledge, and we will see you then.
Yes, we will.
Thank you for listening to the Forbidden Doctor podcast. If you are curious about long-life energy enzymes or ageless thyroid, you can purchase them without a membership from our website at forbiddendoctor.com or get our enzyme formula from amazon.com by searching the full term Long-Life Energy Enzymes. Don't forget to take our obligation-free symptom survey to get a free personalized supplement protocol recommended for you by Dr. Jack, Mary, or one of our qualified nutritionists. Take the survey, get a call from our nutritionist to create a protocol and a patient login, then use that login to see your own personal protocol along with any favorites you've saved from our symptom library. Remember, our website and our clinic are here for you always.